Hello, I'm Matthew Weinstock, Managing Editor for Modern Healthcare. Thanks for tuning in to the latest edition of the Checkup. 2020, as we all know, has been a really challenging year across the board. And one area that's started to get increased attention as remote school continues across the country and some states even revert back to remote distance learning is mental health and the impact on children and teens. In fact, this summer, the journal Pediatrics found that 14% of parents reported a worsening behavioral health for their children. I'm joined today by Tim Robinson. He's CEO of Nationwide Children's Hospital in Columbus, Ohio. We're going to talk a little bit more about caring for children during these very difficult times. Tim, thank you so much for being with us today.
My pleasure, Matthew.
So before we delve into some of the mental health care that you're seeing for pediatrics, I want to talk just about where we are in terms of COVID. The American Academy, for Pediatrics, in late November, reported that we were topping now 1 million cases of COVID-19 for pediatrics. What are you seeing at Nationwide? What is your caseload like right now in Columbus? Ohio, obviously, has really become a hotspot again.
Right. Yes, unfortunately, we've seen a pretty dramatic spike in kids being infected by the virus, but unfortunately, unlike adults, we're not seeing the big spike in hospitalizations. You know, our positivity rate is up around 15%. Again, lots of kids, unfortunately, being infected, but our inpatient census and our critical care census is much lower. We still seeing kids get sick and some very sick. But the majority of them, we're able to treat on an outpatient basis. A bigger challenge actually is staffing. And although we've done a really great job of keeping our patients and our staff safe and not having them transmit to each other, we're just experiencing what's going on in the broader community and what's happening in their homes and in their environment. And so a number of staff quarantined. But despite that, because of the challenges on the adult side, what we've just recently actually just a few days ago, opened it up so that we would start taking some adults up to age 26 to really help some of the overflow that our adult partners are seeing in the community where the hospitalization rate has grown dramatically.
Oh, interesting. So you're bringing into an inpatient setting some adults?
Yeah, so very select patients that we all have historically seen adults with congenital heart or cystic fibrosis, a whole host of areas where we have some abilities and can safely take care of them. So we've targeted those types of patients.
Is there a challenge for you just in being able to do that from, again, the staffing piece? You're a pediatric hospital and you're bringing in people who are 20 years old. So how do you deal with that part of it?
Yeah, and we do it on a case-by-case basis. But again, because of our experience with some of these congenital issues where they go into adulthood, we do have experience in working with adults in specific areas. So we're not taking COVID patients, we won't take cancer patients, but there are others that we can very safely take care of.
Are you seeing your peers in pediatric hospitals across the country do similar work?
We are. Yeah, we, as a group of children's hospitals in the state of Ohio, the Ohio Children's Hospital, we get together on a weekly basis and share notes, and we're very much experienced in the same types of trends and experiences. And as we look more broadly, our other peers are across the country as well.
Got it. And before we move into the behavioral health piece, just going back to the staffing part for you, what have you been able to do in terms of staffing load? If you've got some staff who are quarantined, are you bringing in temporary staff, or are you trying to find staff from other children's hospitals to come in and augment what you have?
Yeah, so far we've been able to take care of the kids that we need to see. Interestingly, because kids are not in school or out playing as many activities, they're not getting sick in other ways. And so our activity was actually down compared to pre-COVID periods. And so we had a little bit of extra capacity, being very thoughtful about making sure that the quarantine period is measured and appropriate and bringing them back as quick as we possibly can from a safety perspective.
Got it. So let's pivot a little bit now, Tim, to the behavioral health piece. As I said at the outset, that study in the journal Pediatrics in the summer talked about 14% of parents seeing worsening behavioral health with their children. I imagine that's probably accelerated now as we're into November. Can you just talk about what you're seeing at Nationwide in terms of behavioral health. I know some of your clinicians have actually been studying what's going on.
Right. And I would start by saying that prior to the pandemic, we were having a national crisis for kids with suffering from mental health. And so about 4 years ago, we decided that we were going to aggressively try and answer that problem in our community with the support of our board and with our community. And so we developed a strategic plan focused on prevention and access and researching what's some of the causes and some of the treatments that can be deployed. So prior to the pandemic, actually, the first week of March, right before the community started to close down, we had just opened our new Big Lots Behavioral Health Pavilion, which is a 380,000 square foot pavilion, unlike any in the country, focused on inpatient, crisis, intensive day hospital, and a whole host of services. And we had just gotten that open with great fanfare. We had a conference with to talk about this topic with leaders around the country, and then unfortunately we had to shut things down. But we had the luxury of having that resource in place, and we have seen our activity increase pretty significantly over the course of the year. And I think what makes us even more concerned is we don't have the same visibility to the kids and their concerns because they're not physically in school. They're not showing up at their pediatrician's office with the same frequency. So we know that we have more significant issues out there. We've seen the early signs of suicide rates going up and a whole host of other issues, and really, again, concerned about what's below the surface and what we're not seeing, even though we're already seeing an increase in activity.
You talk about that school piece and kids not showing up. I think another part of it obviously is kids spending 8 hours in front of a screen for school. Some kids are suited for that, some aren't. Have you been working with the school systems, or is there a way? Let me rephrase: is there a way providers can work with the school systems to try to get at some of these underlying problems that you're seeing?
Right, and prior to the pandemic starting, we had implemented a whole host of prevention efforts, evidence-based initiatives around suicidality and behavioral issues. And so for us, it was really, how do you pivot that to a more of a telehealth type of environment? And we've tried to do that. We've also have enhanced our televisits, our telehealth visits. We've went from, I think, a couple of thousand last year to having over 200,000 this year, and over half of those are in behavioral health, which is pretty well suited, for that type of treatment. So that's been a big boon for us. But we are hamstrung by the ability to really get true access to the kids.
When you think about that telehealth piece, telepsychiatric care, obviously it can be done, but there must be limitations there, right? For just that personal interaction that you would actually want to see with a therapist or a psychiatrist.
Right. I think for certain kids, it works really, really well. You need to have those initial visits. You need to develop the relationship and the trust. But once that occurs, in many instances, it's even more effective in that we can see their environment and talk to them in a more comfortable setting. But we're, I think, just learning what the positive and the negative aspects of it are going to be over longer periods of time.
Right.
I think here with us to stay, though.
It is here. You think that it'll be something that will continue?
Absolutely. We serve a 32 county area in Ohio, and the truly access and being able to interface with our families and take away some of those travel constraints, I think, is really important on a whole host of areas.
And before you took over as CEO about a little over a year ago, you came up from the finance side. So what are you seeing, and what do you need to see in terms of the reimbursement model to be able to sustain that long term?
Yeah. So, we have a 128-year mission of providing care regardless of ability to pay. We are a safety net hospital in addition to being an academic medical center. The challenges are profound. We have 55% of our kids are on Medicaid. The challenging part with mental health is that the commercial reimbursement is not much better than Medicaid. So it's an issue that, we need to advocate for. We need to be more aggressive in telling the story, and really the return on investment, in terms of the impact it can have on children, both with our government and with the payer community. Because of those challenges, staffing is very difficult, and we can build the brick and mortar, but finding the number of professionals that we need is also one of the more significant challenges for us.
Right, and as you said at the beginning, or a little bit earlier, this was a pandemic, or this was a crisis, sorry, well before the pandemic. So what do you think that's going to mean for staffing going forward? If we were already in a behavioral health crisis for adolescents and children, are you going to be able to find that staff, 2021, 2022?
Sure. And again, we had already had aggressive plans in place to be able to expand our access to care. We're doing everything from, looking at our compensation structures to our training programs, looking at other types of providers. This is an area where partnering with other providers in the community is extremely important, and making sure that they're successful. We've also implemented programs to be able to support our community pediatricians by supporting them. It's called Project Echo, where we have trained behavioral health professionals that meets with a group of pediatricians that helps them look at cases, gives them instruction on how to treat more broadly. And we've really seen some lift from that. So enabling other providers, working with the schools on prevention, and ultimately doing the research to say, how can we, find the causes and also enhance our treatment regimens.
How worried are you, Tim, as once schools start to come back, kids start to go back to school, teachers haven't been seeing kids, and maybe they're not seeing some of the underlying causes. So how worried are you that there's going to be even a greater crisis once kids start to come back, that all of a sudden teachers and social workers in schools are going to be able to see some of these things that they haven't seen over the past year while we've been in remote learning?
Yeah, we are extremely concerned, and we think this along with some of the issues around preventive care and vaccinations on the physical side. We think there's going to be a follow-on effect for years after the pandemic. We saw some of that in 2008, and where really the social determinants of health and the stability of their home life, it dramatically impacted their health. And we think this is even more profound because of the issue of not being able to be in the schools and all the development issues that come along with it as well.
Right. I want to go back to that pavilion you opened. I imagine it's sitting empty now, or you have kids coming in.
We have opened it. We have an emergency department. We have observation units. We have inpatients. Floors that we've opened. We've expanded our capacity. So that's one of the silver linings in terms of our timing, to really be able to resource better. But we were already knowing that we had excess demand for our services. So very pleased.
What are your hopes? What are your hopes for that pavilion going forward?
Well, that will hopefully we'll continue to be able to expand our staffing levels. Inside there is also the research and prevention efforts. One of the unique things about Nationwide Children's is that we have a very large accountable care organization called Partners for Kids, where we go at risk for 400,000 Medicaid kids. And so prevention is really an important element of that, and really looking at, again, population health. And we took risk on the behavioral health spend as well. So we are extremely vested in prevention efforts, working with the schools and putting in programs that hopefully we can slow down the pipeline once we get things stabilized.
And that's kind of unique. You don't hear a lot of people going at risk on a behavioral health piece.
Right, and purely mission driven.
Right.
We think it's really important to treat the whole child. Their physical and their mental health conditions are equally important. We will work, as I mentioned earlier, to advocate for better resourcing, whether it's for talent or for the actual underlying reimbursement that's associated with it. But this is something that we need to do, and our community has acknowledged it. One of the really nice things that we've seen is the philanthropic community has really stepped up in a big way. And I would have said 5 years ago, this was not an area that people were inclined to support. And now it's one of the most significant fundraising areas that we have. And the reason that the pavilion is named the Big Lots Behavioral Health Pavilion is the recognition of the $50 million gift that they gave us to help support our behavioral health efforts. So we are very encouraged by that.
That's great. it's hard to find a silver lining, right, in the pandemic, but maybe one of those things is that people are starting to realize that the brain is actually connected to the body and mental health is health, right?
Right.
Are you starting to hear some of that?
Yeah, I think we were, candidly right, in a couple of years running up to this, and it's been an active conversation that we are having with the children's hospitals across the country and with our elected officials and in our community. And everyone seems to get it. One of the things that we most recently launched was our On Our Sleeves movement, which is a national campaign to raise awareness, to drive down the stigma, to provide educational resources for communities across the country so that they know how to better navigate the environment and to deal with the challenges that they're experiencing. And we would hope to also raise resources for research.
Got it. Lastly, Tim, we're late November, headed Thanksgiving, headed into the holidays in December. What can providers do, particularly on that pediatric children's front, to help families as kids are going to be even more stressed now during the holidays. They're not going to be able to see grandma and grandpa and the rest of their family. So, are you doing anything special on that front?
Yeah, we've got our thought leaders out there, advising the community. Going back to onoursleeves.org, if you go out there, there are resources that help with all those types of content areas that were, just a better coping capabilities, and some education on what adults can do to better navigate the environment.
Got it. Well, Tim, thanks so much for being with us. We know it's a busy time. We really do appreciate you taking some time to talk to us about this very critical issue for children and teens across the country and parents.
No, Matthew, I appreciate the opportunity. Thank you.
Thanks so much, and happy Thanksgiving.
You too. Bye-bye.
Bye. And I'm Matthew Weinstock with Modern Healthcare. Be sure to come back next Monday for another edition of The Checkup.